What I'm going to go through is what the Epilepsy Passport is, how it's created, who will carry it, when it should be updated, and how it can get updated. And before I start doing that, I will just say that so I'm a senior paediatric registrar, so I've seen a lot of the issues that Richard talked about, whether that's in an epilepsy clinic, in the emergency department, or on the ward. So I can say that they're not just there in the reports, they're there in real life, and I think we'll hear that as well from the families who are talking afterwards as well. So the Epilepsy Passport is, like all good ideas, an incredibly simple idea, and we'll all wonder why it hasn't been done before. But essentially what it is, it's a paper record. It will be carried by children and young people with epilepsy, or their parents, obviously depending on the age. And this is crucial, it will carry the relevant and up-to-date clinical information about a child and their epilepsy. Now for me, that point about it being carried by children and young people is absolutely key, because that's what makes this a truly innovative tool that we've developed, and it makes it incredibly novel, because that's what will improve communication most optimally. So by being person-held, it means that it's always there to be used at the most relevant points and contact along the way. And obviously we talked about emergency care being by far the primary aim with this. But by being person-held, it will improve the clarity around the ongoing management for families and for young people. It will also help facilitate better communication between clinical teams, which is, again, the Child Health Review has shown, and other reviews, and before that have also shown this message, it's badly needed, and also within clinical teams as well. So this is the web page, and it's gone live today, which I've never got to say before, but it's always nice to do that. So the website is www.epilepsypassport.org.uk. So if you want to fill in a passport, this is how you do it. You enter that web address in, you come to this web page. Now this is just a screenshot of it, obviously, so it doesn't have everything, but there is information on the background and context, similar to what we've heard from Richard. A lot of the questions that I'll be going through as well about what the passport is about. And there's also links to some guidance documents that we've created for young people, for parents or carers, and also for professionals. So I urge you all to have a look at that. But what I'll draw your attention to is it's very simple once you get to the web page to know how to actually get the passport. There's a big blue button there that says download the Epilepsy Passport. Once you do that, you get to a blank PDF form that we've created. Now, it's a very easy to complete blank PDF form, which means that you can put in all of the salient details about a child or a young person and their epilepsy. And you do that with a combination of tick boxes and free text boxes. Once that's done, you can print it out and you give that hard copy to the young person or to the parent. What we also recommend strongly is that the epilepsy teams filling this out keep an electronic copy, so they can save that to their local secure drive. That's what I'm used to when I've worked in hospitals, where we keep things like clinic letters, etc. And it's important to note, because that's the system, what we don't have is any information kept online. Obviously there are still some hospitals that are sort of keeping paper records, so they can also print out a copy and keep them in the patient notes as well. So from a governance point of view, it has all of that detail. So what did it actually look like? I think, as Judith said, there are some samples around, and hopefully you'll all get a chance to see that before you leave today. But it will print off, as I said, as a piece of paper, but actually in the form of a booklet. That's how it's generated. It's a 4-page booklet, and when it's folded over into the 4 pages, it's A6 size. So a compromise between, it's a good size to be able to carry around, but it also means that you can see it, which is, for me, is getting increasingly difficult. But we've also produced some plastic wallets, which again was what Judith was holding up, and I urge you all to have a look at those. There's one. And that is what makes it wallet size. So that A6 passport, when the wallet is open, fits perfectly in, and then it folds once more to become wallet size. So similar to your rail card, similar to your Oyster card if you're from London, very easy to keep on your person, which is our overwhelming aim. Now this is a section of the passport. Before I go on to that, actually it's important to mention that the plastic wallet that there we go. And the look of the passport that you'll all hopefully have a look at in more detail was developed with the involvement of young people with epilepsy. So page 1 of the passport, what we wanted to have here was the most important information that you'd want to see as a professional in an emergency. Hence you've got demographic details, you've got emergency contact, the seizure type and the epilepsy syndrome. Also on page 1, and this is all without even taking the passport out of the wallet, remember. You have the emergency care plan. So as we've heard a bit about emergency care plans, and a lot of us will know that young people, in a lot of cases, have very tailored emergency care plans. So it's important to know what you need to give, when you need to give it, what else can be given, when does it need to be repeated, when should an ambulance be called. All of that information is extremely prominent and on page 1. Pages 2 and 3, so this is now when you open the passport, contain further background information. I won't go through all of that, but it's things like what you can see up here, the cause of the epilepsy, the medication that the child's on, any other diagnoses that they have that are relevant. And the final page, so page 4, which is the back of the passport, has space for all of your professional contacts. So your epilepsy specialist nurse, your paediatric neurologist, your local consultant paediatrician that you're under, which is where most people do go in case of emergencies, and also your GP, of course. And that's, if you haven't seen enough of the purple wallet, there it is again. So next, who should create the passport? Well, it's any member of the clinical epilepsy team, actually. So that will often be the consultant, maybe the paediatric neurologist. It may, in a lot of cases, be the epilepsy specialist nurse. It could also be as an experienced doctor who's involved in the clinic as well. We see that being done in the epilepsy clinic in an outpatient setting, which in most cases is in the hospital, but obviously it can also be in a community setting too, if that's where they're held. This third point is absolutely key. So we talked about the involvement earlier on in the look of the passport and the look of the wallet, but actually that information needs to be done with young people and with parents and with families. There's no point in, as professionals, filling this in separately and, heaven forbid, post it out or just give it to them on their next visit. They need to be involved from the very initiation of the passport and the creation of their passport. It's also important that the GP obviously knows that this document has been created and that their patient has it. Who will carry it? Well, I've already covered this a lot, and I think Richard mentioned it too. This is the truly innovative thing about the epilepsy passport that you're hearing about today. It's the child or the young person that carries it, or the parent if they feel that their child isn't old enough at this stage. But it's on their person at all times. And that means that so we'll take the emergency example because that's the primary aim. You have a prolonged seizure, an ambulance is called, the paramedic sees this, they get a quick overview of the really important points. You go to the emergency department, the triage nurse similarly gets that information. You then see, some people have obviously have been through this a lot anyway, so you know the different steps you have to go through. Every healthcare professional you see along the way will ask the same questions, and actually they want it all summarised in this way. So here it is presented easily for them, so it will lead to getting through their steps more quickly as well. However, it also is up to the young person or the parent to be able to share this with whomever they want to. So whilst our primary care, what the child health review talked about was emergency care, we also have the option, as Richard has also touched on, of sharing it with whomever you want to. So that might be schools or colleges. So if there are issues with, let's say, stigma or fear or just a bit of a lack of knowledge, it makes it plain for people in education as well to be able to look at this and to know what to do, and hopefully reduce that level of fear, reduce that stigma. So lastly, when should the passport be updated and how should it be updated? Well, this is probably the simplest slide to go through, because whenever there are any relevant changes made to a child's or young person's epilepsy management, you should change the passport. So the obvious ones are if there's a change in medication or an alteration in the emergency plan, that obviously needs to be a change that's made. And the process for doing that is exactly the same as the one I've been through, or perhaps even a little bit simpler, because if people are keeping a copy saved electronically, then they've already got that generated and they just need to make the appropriate changes. Print it out again. There's space on the passport to sign and date so that people who then view it know that it's the most up-to-date version. So just to summarise, the epilepsy passport is patient-held. It has up-to-date, relevant clinical information. It's a truly innovative tool, and it will be throughout actually a child or young person's life. So from the clinic where it's created and to subsequent visits, into the community, into day-to-day life. So it could be used at schools, colleges, or at play groups, anything. And of course in emergencies. So we really think this is going to be a really important, crucial and innovative tool for children, young people, parents and professionals alike.